live on TikTok, and we're going live on Instagram, and you are live.
Hello everybody, thank you for joining us for Thursday Thoughts here at Pure Plastic Surgery. I'm Dr. Wegerif, and we're going to be going over an interesting subject today. One that bothers a lot of people and that we haven't really had a great treatment option for a long time. And I believe we have actually a pretty good treatment option for it now, and so we're going to be talking about the condition and how we can treat it. So first of all, what are we talking about? We're talking about cellulite. This is something that bothers a lot of people, women in particular, and we've tried many different things to treat this over the years. So first of all, let's get into what exactly is cellulite. All of our skin is attached to our deeper tissues with collagenous bands called septae, and some of those collagenous bands are tethering the skin a little deeper than other areas. And that's what causes this irregular contour, or those little dimples that we can see that we refer to as cellulite. So how can we treat that? We need to actually get in there and be able to break up those septae that are tethering the skin down. And in the past, we've tried quite a few different things to do that. You know, there was ways to blindly cut underneath the skin, but that could lead to issues with the skin actually doing the opposite thing and bubbling up in those areas where we did that too aggressively. They had a collagenase, or something that, a medication that actually broke down the collagen bands, and there was some promise with that, but it actually started leading towards pigmentation of the skin, so people did not like that trade-off. And now we have a new option that's helping us very closely target those areas that are bothering you. So we're talking about the Avéli device that we're going to be offering here at Pure Plastic Surgery. We already do offer. And this is a minimally invasive device that we can use under local anesthetic while you're wide awake here on the clinic side, or in combination with one of your other procedures while you're asleep under general anesthesia. And what is this device doing? We'll actually kind of look at the website real quick to get some pictures as to what it is, but this is kind of a depiction of this device grabbing one of those bands. This is your skin dimpling down to that little area of cellulite, and this device is going to target that, tug on it. We're going to be able to see it from the surface and actually then activate the blade that divides those pinpoint areas, so we're very precisely managing this problem. Okay, so this is that actual device, and it's a great device. They thought of a lot of cool features with it, and one thing is, if you take this out, a little light lights up here, and you can actually see the light underneath the skin, so you know that you're kind of at the right depth to where you should be finding those septae. And then it's kind of hard to see, but you deploy it, and this puts a blunt edge up that we can pull back on those little septae, and we'll be able to see the area of cellulite that we're trying to treat actually pull in and retract. That's how we know we're at the right spot. And then we can activate the blade by removing the guard, pull back, divide that, and very precisely treat the areas of cellulite that are causing your problem. So I think it's a great device. They really put a lot of thought into managing a lot of the issues we've seen with this in the past, and the fact that we can do it under local anesthetic, which is a little tumescent numbing medication, is a great option for people, or just in combination with your other procedure that you may be getting. You know, it's one of the things that has bothered people for a really long time, and we just haven't had a great option for. I think this is a good option. So these are some before and afters directly from their website, just because I don't have any fancy ones like this yet, but you can kind of go to their website and see what you can, what kind of results you can expect with a well-trained surgeon. Also, our nurse practitioners are doing this here at Pure Plastic Surgery in our aesthetic center under local, but you know, we can obviously do it during your surgery as well. So do we have any questions on Cellulite or the Avéli device? Avéli, sorry, said that wrong.
That's for hanging out with Willie. Okay. Could it be combined with a BBL?
So that is a great question, and actually no, we don't want to combine this with the BBL for the purpose that I stated earlier. If we're releasing a lot of areas of tethering, if it's one or two small areas, possibly it could be combined with BBL, but if there's multiple areas to be treated, we don't want to do that because the fat grafting underneath of it could actually cause that area to bubble out rather than be tethered down. So the recommendation for someone that wants to have this and then have a BBL is to get this done beforehand, then have the recover from that, and then get the BBL or the fat grafting underneath.
Okay. This is about the drainless tummy tuck and ask if everybody is a candidate.
So most people are a candidate. I'll say I've actually dropped my BMI requirement for the drainless tummy tuck to BMI of 32 or below. Because patients with a higher BMI, I have to dissect a larger area, and I think they just might be slightly more prone to developing a seroma. So we're limiting it to patients below a BMI of 32.
Below or 32. Okay. Interactions from TikTok. And how many treatments I need to get rid of cellulite with Avéli?
So this depends on how many areas are affected, but to treat one little dimple of cellulite, you only need one treatment. If it's done correctly, that should be all you need to treat it. If you have multiple areas, it may depend on how much you'll tolerate doing at one time, or if you just have many dimples in one area, we may need to do it more than once just to make sure we get everything. But the technical answer is you really only need to treat it one time. It's not like the collagenase injections that they were doing before, where you would sometimes need to inject them multiple times.
Okay, and this is your TikTok too. My major problem is in the thighs. This works on thighs too?
Yes, this can also help with the thighs. All right, everybody, thank you so much for tuning in. I hope everybody has a great day. We'll see you next week.
Okay, and